Welcome back, nursing champions. Today marks an incredible milestone. You have made it to practice test 10 of our powerful 30 days, 30 practice tests NCLEX challenge. By sticking with us through these tests, you are not just practicing. You are building rock-solid confidence, sharpening your clinical judgment, and mastering the strategies you need to pass the NCLEX on your very first attempt. We are here with 75 questions every single day. And here is the best part. Every question in today's test is designed to challenge you, push your critical thinking, and prepare you for the real exam. So stay focused, stay positive, and let us dive into Practice Test 10, your next big step toward NCLEX success. Let us kick off with an important question on client education regarding anxiety medications. Question 1. The nurse is providing discharge teaching to a client who has been started on buspirone for generalized anxiety disorder. Which client statement indicates that the client needs additional teaching? Here are the options. A. It might take a few weeks before I start feeling better. B. I should take this medicine regularly, either with or without food, but in a consistent way. C. I will take this medicine only when my anxiety becomes really severe. D. I might feel a little nauseous while taking this medicine. The correct answer is C. I will take this medicine only when my anxiety becomes really severe. This choice signals a clear misunderstanding that requires the nurse's follow-up, because buspirone is not designed for as-needed use during severe anxiety episodes. Unlike fast-acting benzodiazepines such as alprazolam or diazepam, buspirone is meant to be taken consistently on a scheduled basis, usually daily, to gradually lower anxiety levels over time by working on serotonin receptors, rather than through sedation. Now, as for the other options, Option A is actually correct and reflects the client's accurate understanding, as buspirone typically takes between 2 to 4 weeks to reach its full therapeutic effect. Option B also shows proper knowledge, since buspirone can indeed be taken with or without food, but consistency in how it is taken helps maintain steady absorption. Option D demonstrates the client's awareness of a common side effect, as mild nausea, along with dizziness, is relatively typical due to the medication's action on serotonin. Moving forward to a critical question on fluid balance and endocrine disorders. Question 2. The nurse is caring for a client who has been diagnosed with nephrogenic diabetes insipidus. Which medication should the nurse anticipate the healthcare provider will prescribe to help manage this condition? Here are your options. A. Prednisone. B. Hydrochlorothiazide. C. Verapamil. D. Lithium. The correct answer is B. Hydrochlorothiazide. This choice is correct because hydrochlorothiazide, though a thiazide diuretic, works in a paradoxical way in clients with nephrogenic diabetes insipidus. Instead of causing increased urination, it actually helps reduce urine output by enhancing sodium and water reabsorption in the proximal tubules. This ultimately leads to less polyuria and helps with fluid balance. Now, let us review the other options. Option A, prednisone, is a corticosteroid that is mainly used for inflammatory conditions or adrenal insufficiency, so it would not be helpful in addressing the mechanism behind nephrogenic diabetes insipidus. Option C, verapamil, is a calcium channel blocker that treats hypertension, angina, and migraines, but it has no role in managing this form of diabetes insipidus. Option D, lithium, is especially important to highlight because lithium is actually a known cause of nephrogenic diabetes insipidus, not a treatment. In fact, if lithium is contributing to the condition, the first step would be to discontinue it. Question 3. Let us shift our attention to a vital topic in cardiovascular nursing. The nurse is assessing a client who has been diagnosed with systolic heart failure. Which finding would be most consistent with right-sided heart failure? The options are A. Ascites, B. Tachypnea, C. Cough, D. Orthonia. The correct answer is A. Ascites. This is because ascites, or fluid accumulation in the abdomen, is a classic sign of right-sided heart failure. Right-sided heart failure leads to congestion within the systemic circulation, so other expected findings include peripheral edema, jugular vein distension, weight gain, and low urine output. Now, let us review the other choices. Option B, tachypnea, is more typical of left-sided heart failure, where pulmonary congestion causes shortness of breath. Option C, cough, is also linked to left-sided heart failure due to fluid backing up into the lungs. Option D, orthopnea, describes difficulty breathing when lying flat, another hallmark of left-sided heart failure. A key clinical reminder is that systolic heart failure is defined by an ejection fraction below 40%, and it is important to differentiate the signs of left and right-sided involvement. Question 4. Continuing with a critical topic in hematology, let us consider this next scenario. The nurse has completed a staff education session on disseminated intravascular coagulation, or DIC. Which client would the nurse recognize as being at greatest risk for developing DIC? The options are A. A client with iron deficiency anemia receiving intravenous iron sucrose. B. A client being treated for gram-negative sepsis with intravenous antibiotics. C. A client with atrial fibrillation prescribed rivaroxaban for stroke prevention. D. A client taking daily aspirin to reduce their risk for acute coronary syndrome. The correct answer is B. A client being treated for gram-negative sepsis with intravenous antibiotics. Gram-negative sepsis is a well-known and powerful trigger for DIC because the endotoxins released by bacteria can excessively activate the clotting cascade. This results in rapid consumption of clotting factors and platelets, followed by severe bleeding and potential organ damage. Let us quickly review the incorrect options. Option A is not the right answer, as iron deficiency anemia and its treatment do not contribute to DIC development. Option C is incorrect, because rivaroxaban is actually given to reduce clot risk, and atrial fibrillation itself does not cause DIC. Option D is incorrect because aspirin lowers coronary risk but does not trigger DIC clinically. Always remember that DIC is a life-threatening emergency linked to conditions like eclampsia, gram-negative sepsis, and certain malignancies, and management may involve blood products or heparin in select cases. Question 5. Now, let us move on to a critical scenario involving a diabetic emergency. The nurse in the emergency department is caring for a client admitted with diabetic ketoacidosis, or DKA. Which clinical finding requires the most immediate follow-up? The options are A. Respiratory rate 23 per minute, B. Capillary blood glucose 319 milligrams per deciliter, or 17.70 millimoles per liter. C. Mean arterial pressure 51 millimeters of mercury. D. Partial pressure of oxygen 90 millimeters of mercury. The correct answer is C. Mean arterial pressure 51 millimeters of mercury. This is because a mean arterial pressure of 51 is dangerously low, signaling inadequate perfusion to vital organs. In general, a mean arterial pressure of at least 60 is necessary to sustain organ function, with 70 being even more desirable to ensure optimal perfusion. This low value requires immediate intervention to prevent organ damage. Now, let us review the other options. Option A describes a mildly elevated respiratory rate, which is actually expected in diabetic ketoacidosis as part of the compensatory Kussmaul respirations responding to metabolic acidosis. While it should be monitored, it does not need immediate action at this level. Option B refers to a high blood glucose level, which is characteristic of DKA and certainly requires treatment, but the low perfusion pressure is a more urgent concern. Option D shows a normal PaO2, so there is no issue with oxygenation in this case. Clinically, always remember that managing DKA starts with aggressive fluid resuscitation, insulin administration, and close monitoring of electrolytes like potassium to prevent dangerous complications. Feeling overwhelmed about the NCLEX? Do not worry. We have created the complete NCLEX review course to guide you one step at a time. You will get live classes, 100 hours of easy-to-follow animated crash courses, 500 hours of recorded lectures you can review at your own pace, 500 NGN questions explained so clearly, and 5,000 previously asked NCLEX questions. And that is not all. You also get 15 CAT-style mock tests, our exclusive NCLEX ebook, personalized study planners, PDF notes, and a full year of access. With this course, you will feel ready and confident when test day comes. Enroll now, the link is in description. Question 6. Next, let us turn to a situation involving ethics and communication. A client requests to change rooms after overhearing that their roommate is positive for human immunodeficiency virus, or HIV. What is the most appropriate action for the nurse to take? The options are A. Move the client to a private room. B. Ask the client to share more about their concerns. C. Notify the hospital's risk management department. D. Place an additional divider between the two beds. The correct answer is B. ask the client to share more about their concerns. This approach reflects therapeutic communication and helps the nurse explore the client's fears or misconceptions in a supportive, non-judgmental manner. It also opens the door to providing accurate education about HIV transmission, which can help reduce stigma and anxiety. Now, let us consider why the other options are not the best choice. Option A is not appropriate because there is no medical need to move the client, and doing so would actually reinforce stigma unnecessarily. Option C is not warranted either, since no risk management or liability concern exists in this situation. Option D fails to address the root issue, the client's misunderstanding, and could actually increase feelings of fear or separation. As a key point to remember, HIV is not spread through casual contact, and standard precautions are sufficient. Nurses play a vital role in addressing stigma and fostering an inclusive, respectful environment. Question 7. Let us now look at an important medication safety teaching point. The nurse is providing discharge instructions to a client who has been prescribed sulfamethoxazole trimethoprim. Which instruction should the nurse emphasize during teaching? The options are A. It is okay to stop taking this medication once you start feeling better. B. You should limit your fluid intake to avoid high blood pressure. C. You need to increase your fluid intake while taking this medication. D. Seek emergency care if your urine becomes dark brown. The correct answer is C. You need to increase your fluid intake while taking this medication. This is because sulfamethoxazole trimethoprim is a sulfa-based antibiotic that can cause crystalluria and nephrotoxicity if fluid intake is inadequate. By encouraging the client to drink plenty of fluids, ideally a full glass of water with each dose and increased intake throughout therapy, the nurse helps reduce the risk of kidney-related complications. Let us review the other options. Option A is incorrect because clients must always complete the full course of antibiotics to ensure the infection is fully treated and to prevent antibiotic resistance. Option B is not appropriate, as fluid restriction would actually increase the risk of crystalluria rather than prevent it. Option D is incorrect because while dark brown urine might occur as a benign side effect, it does not typically signal a need for emergency care. Other signs, like rash or kidney-related symptoms, would be more concerning. As a final pearl, always remind clients that hydration is key to minimizing adverse effects with this medication. Question 8. Let us shift our focus to a critical care medication scenario. The nurse has initiated a prescribed dopamine infusion for a client. What is the primary therapeutic goal of this medication? The options are A. To dilate peripheral blood vessels, B. To reduce myocardial oxygen demand, C. To promote sodium and water retention, D. To increase cardiac output. The correct answer is D. To increase cardiac output. Dopamine's primary action in critical care settings is to enhance myocardial contractility and stroke volume, which improves cardiac output and helps correct hypotension by boosting tissue perfusion. Now, let us briefly consider the incorrect choices. Option A is not the best answer, as while dopamine may cause vasodilation at low doses, its main goal during shock management is to increase cardiac output. Option B is incorrect because dopamine does not lower myocardial oxygen demand. In fact, by increasing cardiac work, oxygen demand may rise. Option C is not correct either, as dopamine does not primarily act by promoting sodium and water retention in this context. Clinically, dopamine infusions require close titration and monitoring, often via central venous access, to reduce risks such as extravasation or tissue injury. Question 9. Finally, let us review a key teaching scenario involving pediatric care. The nurse is providing teaching to the parents of a child with cystic fibrosis. Which parent statement would require the nurse to provide further clarification? The options are A. Chest physiotherapy should be done before giving the bronchodilator. B. The bronchodilator should be given before my child does strenuous activities. C. My child might have difficulty sleeping if the bronchodilator is given at night. D. When my child is sick with a respiratory illness, they should drink extra fluids. The correct answer is A. Chest physiotherapy should be done before giving the bronchodilator. This statement needs clarification because bronchodilators should be administered before chest physiotherapy. Giving the bronchodilator first helps open the airways, making the chest physiotherapy much more effective at clearing mucus and secretions. Now, for the other choices. Option B is accurate because using a bronchodilator before exercise can help prevent exercise-induced bronchospasm. Option C is correct as well, since bronchodilators can stimulate the release of catecholamines and may interfere with sleep if given near bedtime. Option D is also appropriate, as increasing fluids during respiratory illness helps thin mucus and promotes secretion clearance. This is a great example of how detailed teaching can make a real difference in managing chronic conditions like cystic fibrosis. Question 10. Let us now look at an important pre-procedure instruction scenario. The nurse is preparing a client scheduled for a gastric analysis at 8 a.m. the following day. Which instruction should be included in the plan of care? The options are: A. Instruct the client to avoid eating or drinking anything after midnight. B. Tell the client they can chew gum if they feel hungry before the test. C. Advise the client that bed rest is needed for 2 hours following the procedure. D. Inform the client that smoking is permitted up to 1 hour before the test. The correct answer is A. Instruct the client to avoid eating or drinking anything after midnight. This is because maintaining an NPO status for 8 to 12 hours before a gastric analysis is essential to ensure accurate measurement of gastric secretions. Let us briefly review the other options. Option B is incorrect, as chewing gum or using tobacco before the test can stimulate gastric secretions and interfere with accurate results. Option C is also incorrect, because there is no need for bed rest after a gastric analysis. The client can return to normal activities. Option D is incorrect, since smoking should be avoided prior to the test because it can alter gastric secretion patterns. As a final teaching point, be sure to review any medications that might need to be held before the procedure to avoid inaccurate findings. Question 11. Let us now shift our focus to pediatric post-operative care. A 7-year-old child in the pediatric unit is refusing to ambulate after surgery. What is the most appropriate action for the nurse to take? The options are: A. Offer the child a choice between ambulating at 9 a.m. or at 1 p.m. B. Insist that the child ambulate in the hallway immediately. C. Refer the child for an evaluation by a child psychiatrist. D. Tell the child that they can have ice cream if they agree to ambulate. The correct answer is A. Offer the child a choice between ambulating at 9 a.m. or at 1 p.m. This approach helps give the child a sense of control and encourages cooperation within safe limits. Now let us review the other choices. Option B is incorrect because forcing the child to ambulate can increase resistance and anxiety. Option C is not appropriate at this stage, as the nurse can first use supportive communication strategies. Option D is incorrect because offering a food reward like ice cream resembles bribery rather than therapeutic encouragement. Question 12. Next, let us cover an essential preoperative teaching point. The nurse is providing preoperative teaching to a client scheduled for a pneumonectomy. Which statement should the nurse include in the teaching? The options are: A. You must lie on your non-operative side immediately after surgery. B. You can expect your lung function to return to normal within 2 to 6 hours. C. You should avoid coughing after surgery because you will be suctioned as needed. D. You will be encouraged to get out of bed and walk on the same day as your surgery. The correct answer is D. You will be encouraged to get out of bed and walk on the same day as your surgery. Early ambulation reduces the risk of complications like atelectasis and venous thromboembolism. Option A is incorrect because after a pneumonectomy, clients are positioned on the operative side or supine to prevent mediastinal shift. Option B is incorrect as lung function does not normalize within hours. Recovery is gradual over about a week. Option C is incorrect because coughing is actually encouraged to prevent complications, along with deep breathing and splinting. Question 13. Let us now consider a neurological condition with an important contributing factor. While orienting a new registered nurse in the emergency department, the nurse cares for a client diagnosed with Guillain-Barré syndrome. The new nurse asks what factor in the client's history may have contributed to the development of this condition. Which finding would be most likely associated? The options are: A. A spinal cord injury sustained at age 12. B. A recent upper respiratory infection about 1 month ago. C. Hydrocephalus diagnosed in infancy. D. A joint injury sustained during adolescence. The correct answer is B. A recent upper respiratory infection about 1 month ago. Guillain-Barré syndrome often follows an upper respiratory or gastrointestinal infection and is characterized by autoimmune damage to peripheral and cranial nerves. Option A is incorrect, as a prior spinal cord injury is not linked to this disorder. Option C is not related either, because hydrocephalus is a separate condition involving ventricular enlargement. Option D is unrelated, as joint injuries do not contribute to Guillain-Barré syndrome. Question 14. Finally, let us explore an important concept in nursing leadership. The nurse is discussing nursing leadership and management concepts with a colleague. Which statement reflects an accurate understanding of nurse manager accountability? The options are A. Nurse managers are personally accountable for their actions, as well as for acts of delegation and supervision. B. Nurse managers are not accountable for supervising unlicensed assistive personnel. C. When a task is delegated to the appropriate team member, the delegating nurse is no longer responsible for the outcome. D. Managing care effectively requires micromanaging the unit's staff. The correct answer is A. Nurse managers are personally accountable for their actions, as well as for acts of delegation and supervision. Accountability cannot be delegated. Even when tasks are assigned to others, the nurse manager remains responsible for ensuring safe and appropriate care. Option B is incorrect, because nurse managers must supervise all staff, including unlicensed assistive personnel. Option C is incorrect since delegation does not remove responsibility for outcomes. Option D is also incorrect because micromanaging is not effective leadership and can lower morale and confidence. Question 15. Let us now explore a critical topic in hospital safety and infant security. The nurse is participating in a hospital committee tasked with reviewing the security plan for preventing infant abduction. Which recommendation should the nurse propose to strengthen security measures? The options are A. Rearrange patient rooms so that the crib is positioned near the door. B. Carry infants through hallways rather than using bassinets. C. Issue staff identification badges without a photograph. D. Take photographs of all hospital visitors. The correct answer is D. Take photographs of all hospital visitors. This recommendation provides an added layer of security by creating a visual record of everyone entering areas where infants are cared for. In the unfortunate event of an abduction, these records can aid in identifying suspects. Now, let us look at the incorrect options. Option A is not advisable because positioning cribs near the doorway actually makes it easier for an abductor to act quickly. Option B is inappropriate as infants should always be transported in bassinets, not carried by hand, to maintain proper security and safety. Option C is incorrect because staff badges should always include a photograph for quick verification of authorized personnel. As an additional teaching point, robust infant abduction prevention strategies also include staff training, clear visitor policies, visible security measures, and a lockdown protocol in case of emergency. Picture yourself holding that RN license, confident, proud, and ready to start your nursing journey. Our complete NCLEX review course is designed to turn that dream into reality, with live NCLEX classes, 100 hours of animated crash course content, 500 hours of recorded lectures, 500 in-depth explained NGN questions, and over 5,000 real NCLEX questions. You will be fully prepared. Add 15 CAT-style mock exams, an exclusive ebook, smart study planners, PDF notes, and 1 full year of access. And you have got the ultimate prep package. This is your time. Let us help you make it happen. Enroll now link is in description. Question 16. Next, let us turn to a scenario involving therapeutic group assignments in psychiatric care. The charge nurse on a psychiatric unit is reviewing group therapy assignment. Clients are being assigned to groups based on their diagnoses. Which assignment should the charge nurse recognize as inappropriate and requiring revision? The options are A. A group composed of clients with mild, early-stage Alzheimer's disease. B. A group composed entirely of clients with antisocial personality disorder. C. A group composed of clients who have experienced sexual assault. D. A group composed of clients diagnosed with major depressive disorder. The correct answer is B. A group composed entirely of clients with antisocial personality disorder. This arrangement is problematic because clients with antisocial personality disorder may exhibit manipulative, defiant, or hostile behaviors that could disrupt the group process and overwhelm the group leader. It is more appropriate to integrate these clients into mixed groups where structure and boundaries can be reinforced. Now, for the other options. Option A is appropriate because clients with early-stage Alzheimer's disease can benefit from group therapy by building self-esteem and preserving social skills. Option C is suitable as well, since group therapy can provide essential support and shared coping strategies for survivors of sexual assault. Option D is correct, because clients with major depressive disorder often respond well to the shared experience of group therapy. helping reduce isolation and build coping skills. Question 17. Let us now focus on recognizing the hallmark sign of a sexually transmitted infection. The nurse is assessing a female client suspected of having syphilis. Which finding is most consistent with this diagnosis? The options are A. Painful urination, dysuria, B. Abnormal vaginal discharge, C. Painless chancre lesion, D. Painful intercourse, dyspareunia. The correct answer is C. Painless chancre lesion. Primary syphilis is characterized by a firm, round, ulcerated, and painless chancre that appears at the site where Treponema pallidum entered the body, usually about 3 weeks after exposure. This lesion commonly develops on the genitals, anus, or mouth and heals spontaneously within a few weeks. However, without treatment, the infection will progress to more serious stages. Option A is incorrect, as dysuria is more typical of infections like chlamydia or gonorrhea. Option B is incorrect because abnormal vaginal discharge is not a hallmark of syphilis. It is seen in conditions like trichomoniasis or bacterial vaginosis. Option D is incorrect since dyspareunia is more associated with pelvic inflammatory disease or vaginal infections. Always remember that the treatment of choice is intramuscular penicillin G-benzathine, and syphilis is a reportable disease that requires public health notification. Question 18. Next, let us review proper newborn care during swaddled bathing. The nurse observes parents bathing their infant using swaddled bathing during a home visit. Which parent action would require follow-up? The options are A. Completely removing the blanket before washing the infant, B. Using a gentle, mild soap, C. Bathing the infant in a warm, draft-free room, D. Exposing and washing one body area at a time. The correct answer is A. Completely removing the blanket before washing the infant. The purpose of swaddled bathing is to keep the infant mostly wrapped, exposing only one body part at a time, which helps reduce heat loss and stress. Completely unwrapping the infant increases the risk of cold stress and temperature instability, especially concerning in newborns. Option B is appropriate, as mild soap is gentle on the infant's skin. Option C is correct practice because a warm, draft-free room prevents chilling. Option D reflects proper technique, as washing one area at a time helps maintain warmth. Remember, never leave an infant unattended during a bath, and always gather all necessary supplies beforehand to ensure safety and comfort. Question 19. Let us now shift our attention to a teaching scenario involving dietary prevention strategies. The nurse is teaching a client about using cranberry juice to help prevent recurrent simple cystitis. What is the intended effect of consuming cranberry juice? The options are A. To increase urine-specific gravity, B. To increase urine leukocyte levels, C. To acidify the urine, D. To increase protein in the urine. The correct answer is C. To acidify the urine. Cranberry juice is believed to help prevent cystitis by creating a more acidic urinary environment, which can make it harder for bacteria to thrive. Although the supporting evidence is limited, this is the proposed mechanism by which cranberry juice offers protection. Now, let us review the other options. Option A is incorrect, because increasing urine-specific gravity means the urine is more concentrated, which can actually raise the risk of infection rather than prevent it. Option B is also incorrect, as an increase in leukocytes would indicate the presence of infection, not something we want to promote. Option D is incorrect because protein in the urine signals possible kidney damage, and this is certainly not a desired outcome. A helpful additional point is that cranberry tablets may be a better option than juice for some clients, as they avoid the added sugar found in juice, and clients should be encouraged to drink plenty of fluids overall to flush bacteria from the urinary tract. Question 20. Now let us review an essential infection control practice that every nurse must master. The nurse is leading a staff meeting on standard precautions. In which situation is it essential to wash hands with soap and water rather than use an alcohol-based sanitizer? The options are A. When hands are visibly dirty or soiled, B. When checking a client's vital signs, C. When assisting with range of motion exercises, D. When using the electronic medical record. The correct answer is A. When hands are visibly dirty or soiled. Soap and water are required in this situation to ensure the removal of visible debris and contamination, and also after contact with certain organisms like Clostridioides, difficile, or norovirus. Let us go through the incorrect options. Option B is not correct. as hand sanitizer is acceptable after checking vital signs when hands are not visibly dirty. Option C is incorrect because routine range of motion exercises do not necessitate soap and water unless contamination occurs. Option D is incorrect as well. Using the electronic medical record does not require hand washing. One final pearl to remember is that while alcohol-based hand rubs are highly effective and preferred in most situations, hand washing with soap and water should last at least 20 seconds and cover all surfaces, including between the fingers and under the nails, for thorough cleansing. Question 21. Now let us shift to an important teaching point on dietary restrictions with certain antidepressants. The nurse is teaching a client who has been prescribed phenelzine. Which food should the nurse instruct the client to avoid while taking this medication? The options are A. Smoked bacon, B. Scrambled eggs, C. Milk, D. Kale. The correct answer is A. Smoked bacon. Phenelzine is a monoamine oxidase inhibitor, or MAOI, used in managing severe depression, and consuming foods high in tyramine, such as smoked bacon, can lead to a dangerous hypertensive crisis. Clients should also avoid aged cheeses, cured meats, fermented products, beer, and red wine for the same reason. Reviewing the other options, option B is safe because scrambled eggs do not contain tyramine. Option C is acceptable, as milk does not interact with MAOIs, although fermented dairy products should be avoided. Option D is not problematic, since kale does not interact with MAOIs, though certain other vegetables like Italian green beans are best avoided. A key teaching point is to provide clients with a full list of high tyramine foods and encourage them to read labels carefully. Question 22. Let us now review a scenario involving delegation and supervision. The nurse manager is reviewing tasks assigned to unlicensed assistive personnel. Which task requires follow-up by the nurse manager? The options are A. Providing perineal care to a client with an indwelling urinary catheter. B. Performing range of motion exercises. C. Reminding a client how to care for their colostomy. D. Ambulating a client using a gait belt. The correct answer is C. Reminding a client how to care for their colostomy. This is because unlicensed assistive personnel are not permitted to provide client teaching or reinforce client education. This responsibility belongs to a licensed nurse who can ensure accurate and appropriate instruction. Now for the incorrect choices. Option A is appropriate, as UAPs can perform perineal care, which is important in preventing catheter-associated infections. Option B is suitable because passive range of motion exercises fall within the UAP's role. Option D is correct delegation too, as UAPs may ambulate clients using gait belts when following proper safety procedures. Remember, teaching or reinforcing teaching must always stay within the licensed nurse's scope of practice. Question 23. Moving on, let us consider a sensitive topic involving antidepressant use during pregnancy. The nurse is caring for a client who is 6 weeks pregnant and asks about continuing her prescribed antidepressant. Which client statement reflects an accurate understanding? The options are A. I need to stop my antidepressant until after I deliver. B. Pregnancy will make my depression go away, so I will not need an antidepressant. C. I may need to switch to a different antidepressant while I am pregnant. D. If I stay on my antidepressant, I will have to have a cesarean section. The correct answer is C. I may need to switch to a different antidepressant while I am pregnant. This is because while many antidepressants, particularly selective serotonin reuptake inhibitors like sertraline, are considered safe during pregnancy, some, such as paroxetine, carry a higher risk of fetal abnormalities and may need to be switched. Option A is incorrect, as stopping antidepressants abruptly can risk a relapse or worsening depression, including possible self-harm. Option B is inaccurate because pregnancy does not resolve depression. In fact, hormonal shifts may heighten mood instability. Option D is also wrong. Being on an antidepressant does not dictate the need for cesarean delivery. The key is careful collaboration between the nurse, provider, and client to ensure safe mental health management during pregnancy. Question 24. Finally, let us examine a psychological concept commonly encountered in client interactions. A nurse is caring for a client who missed their last appointment with the primary healthcare provider. The client says, I missed my appointment because I overslept, but I knew it would be pointless anyway. Which defense mechanism is the client demonstrating? The options are A. Projection, B. Reaction formation, C. Denial, D. Rationalization. The correct answer is D. Rationalization. This occurs when an individual justifies or explains away behavior in order to avoid guilt or responsibility. In this case, the client overslept but deflects accountability by suggesting the appointment would have been pointless. Now for the other options. Option A, projection, involves attributing one's unacceptable thoughts or feelings to someone else. Option B, reaction formation, is when a person behaves in a way that is the opposite of their true feelings. Option C, denial, means refusing to accept reality or facts, something not seen here since the client admits missing the appointment. As a clinical pearl, nurses should foster supportive communication to help clients explore their feelings rather than rely on maladaptive defenses. Question 25. Let us now focus on an important medication teaching scenario. The nurse is teaching a client who has been prescribed an allopril. What information is most important for the nurse to emphasize? The options are A. This medication may cause you to develop a dry cough. B. If you notice swelling of your face, lips, or eyes, contact your healthcare provider immediately. C. You may notice that the taste of food changes while on this medication. D. You will need periodic lab tests while taking this medication. The correct answer is B. If you notice swelling of your face, lips, or eyes, contact your healthcare provider immediately. Enalapril, an angiotensin-converting enzyme inhibitor, can cause angioedema, a rare but life-threatening reaction that can lead to airway obstruction. Early recognition of facial or lip swelling and prompt medical attention can prevent serious complications. Now let us review the other options. Option A is incorrect because while a dry cough is common with ACE inhibitors, it is not dangerous. Option C refers to dysgeusia, or altered taste, which is harmless though sometimes bothersome. Option D is true. Lab monitoring of potassium and renal function is important, but the priority teaching is recognizing and responding to signs of angioedema. Always emphasize to clients that angioedema is a medical emergency requiring immediate care. Over 100,000 students have trusted our complete NCLEX review course. And here is why. You get live NCLEX classes, 100 hours of animated crash course material, 500 hours of recorded lectures, 500 NGN questions with detailed explanations, 5,000 real NCLEX questions, and 15 CAT-style mock tests. Plus, we include an exclusive NCLEX ebook, flexible study planners, PDF notes, and a full year of access. This is the comprehensive, trusted prep that helps future nurses succeed. Are you ready to join them? If yes, enroll now. Link is in description. Question 26. Next, let us consider a scenario involving pediatric safety. The nurse enters the room of a 5-year-old client and finds the child lying on the floor after an unwitnessed fall. What is the nurse's priority action? The options are A. File an incident report. B. Assist the child back to bed. C. Call for help. D. Assess the child for injuries. The correct answer is D. Assess the child for injuries. The immediate priority is to evaluate for injury, including any loss of consciousness, fractures, or neurological deficits, before moving the child. This ensures that further harm is avoided. Reviewing the incorrect options, option A is premature. Documentation follows once safety is ensured. Option B is unsafe, as moving the child before assessment could worsen any injury. Option C may be necessary, but the first action is to assess so the nurse can determine the need for assistance or additional resources. Remember, patient safety and thorough assessment always come first. Question 27. Now, let us review proper technique for assisting with elimination needs. The nurse is assisting a client in using a fracture bedpan. Which action is appropriate? The options are A. Position the client prone while placing the bedpan. B. Raise the head of the bed to about 30 degrees. C. Place the open rim of the bedpan toward the client's head. D. Lower all of the side rails. The correct answer is B. Raise the head of the bed to about 30 degrees. Elevating the head of the bed helps the client assume a natural position for elimination, reduces aspiration risk, and promotes comfort. Now for the other options. Option A is incorrect, as the prone position is not appropriate for bedpan use. Option C is wrong because the fracture bedpan should be positioned with the shallow end under the buttocks and the open rim facing the feet. Option D is incorrect, since lowering all side rails increases fall risk. At least one side rail should remain up for safety. Always ensure clients feel supported and safe when assisting with elimination. Question 28. Let us now focus on a crucial post-operative assessment. The nurse is caring for a client following cervical spinal surgery. Which of the following findings requires immediate follow-up? The options are A. Active movement in both arms, B. A small amount of drainage on the surgical dressing, C. Difficulty swallowing liquids, D. Mild soreness at the surgical site. The correct answer is C. Difficulty swallowing liquids. Difficulty swallowing could indicate serious complications such as swelling, hematoma formation, or nerve injury, all of which can compromise the airway and require immediate medical attention. Now, let us consider the other options. Option A is a reassuring sign indicating intact motor function. Option B is expected. A small amount of drainage is common after surgery. Option D is also normal, as mild soreness at the surgical site is to be anticipated. Remember, in cervical spine patients, airway compromise is a top priority, so subtle signs like difficulty swallowing should never be overlooked. Question 29. Let us now review a priority nursing action following chest tube placement. The nurse is caring for a client 2 hours after the placement of a water seal chest tube for a hemothorax. The nurse notes that the drainage in the collection chamber has decreased from 50 milliliters in the previous hour to 25 milliliters in the most recent hour. What is the priority nursing assessment? The options are A. Assess for titling in the water seal chamber, B. Inspect the tubing for any kinks or obstruction, C. Check the system for an air leak, D. Observe for bubbling in the suction control chamber. The correct answer is B. Inspect the tubing for any kinks or obstruction. In the early post-operative period, chest tubes placed for a hemothorax are expected to drain blood steadily, often between 100 to 300 milliliters in the first few hours. A sudden or unexpected reduction in drainage may signal a tubing obstruction or kink that prevents effective evacuation of blood. The nurse's immediate priority is to inspect the tubing thoroughly and reposition the client if necessary to ensure patency. Option A is incorrect because while titling shows the system is intact, it does not explain reduced drainage. Option C is incorrect because air leaks typically cause continuous bubbling in the water seal chamber, and this finding is associated with pneumothorax rather than reduced drainage. Option D is incorrect because bubbling in the suction control chamber relates to suction function, and in a water seal system without suction, this is not a concern. Always keep emergency supplies like clamps and sterile water at the bedside, and notify the provider promptly if drainage issues persist or if the client shows signs of distress. Question 30. Let us now turn to a critical emergency scenario related to peptic ulcer disease. A nurse is caring for a client diagnosed with peptic ulcer disease who suddenly reports severe upper abdominal pain, a rigid and board-like abdomen, and shoulder pain. What is the priority nursing action? The options are A. Administer the prescribed antacid via nasogastric tube, B. Notify the healthcare provider immediately, C. Reassure the client that the pain will subside with medication, D. Place the client in a high Fowler's position and provide oxygen. The correct answer is B. Notify the healthcare provider immediately. These findings strongly suggest a perforated ulcer, a life-threatening condition that requires immediate medical and surgical intervention to prevent peritonitis and sepsis. The nurse's top priority is to contact the provider so that emergency care, including surgery, can be initiated without delay. Option A is incorrect, as an antacid will not resolve a perforation and could delay life-saving care. Option C is incorrect because offering reassurance without acting would dangerously postpone necessary intervention. Option D is incorrect because, while positioning and oxygen might provide some comfort, they do not address the life-threatening cause, and notifying the provider takes priority. Question 31. Next, let us review pharmacologic management for an eating disorder. The nurse is planning care for a client diagnosed with bulimia nervosa. Which medication is most likely to be prescribed? The options are A. Metformin, B. Bupropion, C. Fluoxetine, D. Clozapine. The correct answer is C. Fluoxetine. Fluoxetine, a selective serotonin reuptake inhibitor, is the only SSRI approved for bulimia nervosa. It helps reduce binge purge behaviors and addresses mood and anxiety symptoms. Option A is incorrect because metformin is used for diabetes, not bulimia. Option B is inappropriate as bupropion is contraindicated in bulimia due to increased seizure risk. Option D is incorrect because clozapine is used for schizophrenia, not eating disorders. The best outcomes in bulimia management involve combining medication with psychotherapy and nutritional counseling. Question 32. Let us now look at a vital communication strategy to promote safe discharge teaching. The nurse is providing discharge instructions to a client who speaks a language different from the nurse's. The client's family members, who speak English, are present. What is the most appropriate action to ensure the client receives accurate information? The options are: A. Use a smartphone translation app to deliver instructions. B. Provide written instructions in the client's language, but give verbal instructions in English. C. Request a professional medical interpreter. D. Ask the family members to translate the discharge instructions. The correct answer is C. Request a professional medical interpreter. This ensures accurate, complete, and unbiased communication that meets legal and ethical standards, while supporting the client's understanding and safety. Option A is incorrect because apps can be unreliable for complex medical information. Option B is inadequate because verbal teaching should be in the client's language, not just written materials. Option D is not appropriate as family members may unintentionally omit or alter information. Nurses should always use professional interpreters for essential medical communication. Question 33. Next, let us examine a prioritization scenario involving a life-threatening condition. The nurse is caring for several assigned clients. Which action should the nurse prioritize first? The options are: A. Evaluate the reactivity of a client's MAN2 tuberculin skin test 48 hours after administration. B. Assess a client with atrial fibrillation who has an irregular pulse of 90 beats per minute. C. Apply a prescribed lidocaine patch to the lumbar area of a client with chronic back pain. D. Administer prescribed ciprofloxacin to a client diagnosed with peritonitis. The correct answer is D. Administer prescribed ciprofloxacin to a client diagnosed with peritonitis. Peritonitis is a life-threatening infection that can progress rapidly to sepsis. Prompt administration of antibiotics is critical to controlling the infection. The other options are not as urgent. Option A involves a test reading that can wait a short time. Option B describes a stable atrial fibrillation rate. Option C is for chronic pain and is non-urgent. Always address life-threatening conditions first to prevent deterioration. Question 34. Finally, let us consider an appropriate dietary recommendation. The nurse is caring for a client with a body mass index, BMI, of 17. Which dietary recommendation is most appropriate for this client? The options are: A. Fat-restricted diet, B. Low-protein diet, C. High-caloric diet, D. Low-sodium diet. The correct answer is C. High-caloric diet. A BMI of 17 indicates the client is underweight, so the goal is to promote healthy weight gain with calorie-dense foods like peanut butter, milkshakes, and fortified cereals. Option A would hinder weight gain and is inappropriate. Option B is incorrect because protein is essential for building lean muscle mass. Option D is not relevant unless there is a comorbid condition like hypertension. Gradual, supervised weight gain along with monitoring for deficiencies is key in managing low BMI. Question 35. Let us now review a critical action in emergency airway management. The emergency department nurse is caring for a client requiring endotracheal intubation. Which medication does the nurse anticipate will be prescribed immediately prior to intubation? The options are: A. Propofol, B. Baclofen, C. Phenytoin, D. Haloperidol. The correct answer is A. Propofol. Propofol is a rapid-acting sedative hypnotic commonly used to induce sedation before intubation, allowing the procedure to be performed smoothly and comfortably for the client. It is typically given as an intravenous bolus and may be followed by continuous infusion if ongoing sedation is needed. Option B is incorrect, as baclofen is a muscle relaxant used for conditions like spasticity, not for intubation. Option C is incorrect because phenytoin is an anti-epileptic agent unrelated to airway procedures. Option D is inappropriate as haloperidol is an antipsychotic and not used for procedural sedation. Always ensure emergency airway equipment and resuscitation supplies are ready when using propofol due to the risk of respiratory depression. Time is precious, and your NCLEX success cannot wait. That is why our complete NCLEX review course gives you everything in one place. Live classes, 100 hours of animated crash courses, 500 hours of recorded lectures, 500 Nigerian Naira questions fully explained, 5,000 real NCLEX questions, 15 CAT-style mock exams, an NCLEX ebook, study planners for any schedule, and PDF notes. Enroll today and get 1 year of unlimited access. Your license is waiting. Let us help you claim it. Question 36. Next, let us practice a dosage calculation essential for pediatric medication safety. The nurse is preparing to administer penicillin V potassium to a child who has pneumonia. The child weighs 18.5 kilograms. The prescription is for 50 milligrams per kilogram per day by mouth, divided into doses every 6 hours. Now, how many milligrams should the child receive per dose? Let us break it down carefully. First, calculate the total daily dose. Multiply 50 milligrams by 18.5 kilograms. This gives us 925 milligrams per day. Since the medication is given every 6 hours, that means there are 4 doses per day. Now, divide 925 milligrams by 4. This gives us approximately 231.25 milligrams per dose. When we round to the nearest whole number, the nurse will administer 231 milligrams per dose. This calculation truly highlights the importance of precise math in pediatric care to ensure both safety and effectiveness of treatment. Question 37. Moving forward, let us examine the therapeutic goal of an antidepressant. The nurse is evaluating a client who is prescribed citalopram. Which finding would indicate a therapeutic response to this medication? The options are A. Improved muscle coordination, B. Circumstantial speech, C. Longer attention span, D. Increased self-esteem. The correct answer is D. Increased self-esteem. Citalopram, a selective serotonin reuptake inhibitor, is used to treat depression and anxiety disorders. A key sign of improvement in depression is increased self-esteem, along with better mood, motivation, and social engagement. Option A is incorrect because citalopram does not impact motor coordination. Option B is incorrect since circumstantial speech is linked to mania or psychosis, not a therapeutic effect of citalopram. Option C is also incorrect as citalopram is not used for attention deficit hyperactivity disorder, where attention span is the target. It is essential to monitor for suicide risk, particularly during the initial weeks of SSRI therapy. Question 38. Let us now review a key priority in post-operative care. The nurse is planning care for a client immediately after surgery. What is the nurse's priority assessment? The options are A. Respiratory status, B. Tolerance to bimouth fluids, C. Pain level, D. Ability to move extremities. The correct answer is A. Respiratory status. In the immediate post-operative period, the highest priority is ensuring airway patency and adequate ventilation. Anesthesia may impair breathing, making early respiratory assessment critical to prevent complications like hypoventilation or airway obstruction. Option B is assessed later after stability is confirmed. Option C, while important, comes after ensuring oxygenation. Option D is a part of the post-operative check but does not take precedence over airway and breathing. Always remember, airway, breathing, and circulation come first. Question 39. Next, let us look at client education regarding antihypertensive medication use. The nurse is visiting a client who recently started antihypertensive medications. Which client statement requires follow-up? The options are A. My pulse decreases after taking my metoprolol. B. I started taking my furosemide right before bed. C. I season my food with salt substitutes while on hydrochlorothiazide. D. I wear my clonidine patch for 7 days. The correct answer is B. I started taking my furosemide right before bed. Furosemide is a loop diuretic that increases urine output, and taking it at bedtime can lead to nocturia, sleep disruption, and higher fall risk. The nurse should advise earlier dosing. Option A is expected, as metoprolol lowers heart rate. Option C is reasonable since salt substitutes may help prevent hypokalemia with thiazides. Option D correctly describes clonidine patch use. Educate clients to take diuretics in the morning to minimize nighttime urination. Question 40. Finally, let us focus on a critical concern following stem cell transplantation. The nurse is creating a care plan for a child recovering from a hematopoietic stem cell transplant. What is the nurse's greatest concern? The options are A. Infection, B. Delirium, C. Nutritional imbalance, D. Oral mucositis. The correct answer is A. Infection. Profound immunosuppression after transplant places the child at extreme risk for life-threatening infections. Preventing and promptly identifying infections is the top priority. Option B can occur but is not as immediately life-threatening. Option C is important but secondary. Option D is common but does not pose the same urgent risk as infection. Strict infection control measures and early treatment of infections are essential to protect these vulnerable clients. Question 41. Let us now focus on an important teaching point for managing hypertension. The nurse is teaching a client with hypertension about the newly prescribed furosemide. What instruction should the nurse include? The options are A. Limit intake of bananas, cantaloupe, and potatoes. B. Avoid taking the medication with grapefruit juice. C. Take this medication in the early part of the day. D. A nagging cough can occur as a side effect of the medication. The correct answer is C. Take this medication in the early part of the day. Furosemide is a loop diuretic that increases urine output, so taking it early helps prevent nocturia and reduces fall risk at night. Option A is incorrect because furosemide is potassium wasting. Clients should actually increase potassium-rich foods like bananas and potatoes. Option B is not relevant, as furosemide does not interact with grapefruit juice. Option D is incorrect because a dry cough is associated with ACE inhibitors, not furosemide. Remind clients to monitor for hypokalemia symptoms and to rise slowly to prevent dizziness. Question 42. Next, let us review safe assignment practices for a floated nurse. The charge nurse in the intensive care unit is assigning clients to a nurse floated from the medical surgical unit. Which client is most appropriate for this nurse? The options are A. A client with bacteremia who is suspected of developing shock. B. A client requiring intravenous vasopressor titration based on hemodynamic monitoring. C. A client receiving intravenous antibiotics and nebulizer treatments for pneumonia. D. A client undergoing targeted temperature management 3 hours post-cardiac arrest. The correct answer is C. A client receiving intravenous antibiotics and nebulizer treatments for pneumonia. This client is relatively stable and within the skills of a med-surg nurse. Option A involves risk for rapid deterioration, requiring ICU expertise. Option B and Option D both require advanced critical care skills for vasopressor management and temperature control post-cardiac arrest. Floating nurses should care for stable clients and have access to ICU team support. Question 43. Let us now walk through a procedure that is common, yet requires precision. The nurse is preparing to obtain a capillary blood glucose sample from a client. Place the steps in the correct order, from first to last. The correct order is: first, verify the code strip matches the meter code. Next, insert the strip into the monitor. Then disinfect the finger with an alcohol swab and allow it to dry. Turn the finger downward to encourage blood flow. Prick the side of the finger with a lancet. Collect the blood drop on the test strip. Hold gauze on the finger after the specimen is obtained. Finally, read the blood glucose level on the monitor. This sequence ensures accurate results and client comfort. Remember, choosing the lateral side of the finger minimizes pain, and excessive squeezing should be avoided to prevent tissue fluid contamination. Question 44. Finally, let us practice a weight-based dosage calculation essential for client safety. Now let us go through another important medication calculation involving enoxaparin. The primary healthcare provider prescribes 1 milligram per kilogram of enoxaparin for a client who weighs 60 kilograms. The pre-filled syringe is labeled as 60 milligrams per 0.6 milliliters. So, how many milliliters should the nurse administer? The calculation is straightforward. Multiply 1 milligram by 60 kilograms, and this gives us a dose of 60 milligrams. Since the syringe contains 60 milligrams in 0.6 milliliters, the nurse will administer 0.6 milliliters. Always remember to double-check anticoagulant dosages carefully to minimize the risk of bleeding. Enoxaparin should be administered subcutaneously, and do not expel the air bubble from the syringe unless specifically directed, as it helps ensure the full dose is delivered safely. Question 45. Let us now shift our focus to medication administration and meal timing. The nurse is teaching a client about proper timing for medications in relation to meals. Which statement by the nurse demonstrates correct understanding? The options are: A. Proton pump inhibitors should be given while the client is eating breakfast. B. Glucocorticoids should be taken on an empty stomach to prevent stomach irritation. C. Rapid-acting insulins should be given about 5 to 10 minutes before meals. D. Levodopa-carbidopa should be taken with a high-protein snack to improve absorption. The correct answer is C. Rapid-acting insulins should be given about 5 to 10 minutes before meals. This timing ensures that insulin action aligns with carbohydrate absorption, effectively controlling post-meal blood glucose levels. Now let us review the incorrect options. Option A is inaccurate because proton pump inhibitors should be given about 30 minutes before meals to maximize acid suppression. Option B is incorrect since glucocorticoids should be taken with food to reduce the risk of stomach irritation. Option D is also incorrect as high-protein foods can impair levodopa-carbidopa absorption by competing for transport across the blood-brain barrier. Proper timing of medications with meals is key to maximizing their benefits and minimizing side effects. Let us cut to the chase. You want to pass the NCLEX, and we have the course that will get you there. With live classes, 100 hours of powerful animated crash course content, 500 hours of recorded lectures, 500 deeply explained NGN questions, and over 5,000 actual NCLEX questions, you are covered. You also get 15 CAT-style mock tests, our exclusive NCLEX ebook, detailed study planners, and PDF notes. Best of all, you have a full year to access it all. Stop searching. This is the NCLEX prep that delivers results. Link is in description. Question 46. Next, let us review a priority assessment in shock states. The nurse is assessing a client with suspected neurogenic shock. Which clinical finding supports this diagnosis? The options are A. Jugular vein distension, B. Bradycardia, C. Fever, D. Bradypnea. The correct answer is B. Bradycardia. Neurogenic shock is unique among shock states because it involves loss of sympathetic tone, resulting in bradycardia and hypotension rather than the usual tachycardia seen in other forms of shock. Option A is incorrect because jugular vein distension is not typical. Peripheral vasodilation leads to flat veins. Option C is incorrect, as hypothermia, not fever, is more common due to loss of thermoregulation. Option D is not correct because tachypnea, not bradypnea, is more likely as the body tries to compensate. Remember, prompt recognition and management of neurogenic shock with vasopressors and fluid resuscitation are critical to restore perfusion. Question 47. Let us now look at an emergency pharmacologic intervention. An emergency department nurse receives a client who was exposed to inhalation anthrax. Which medication does the nurse anticipate the healthcare provider will prescribe? The options are A. Acyclovir, B. Zitavudin, C. Ciprofloxacin, D. Oseltamivir. The correct answer is C. Ciprofloxacin. Inhalation anthrax is a serious bacterial infection requiring immediate bactericidal therapy. Ciprofloxacin is a first-line treatment because of its proven effectiveness against Bacillus anthracis. Option A is incorrect as acyclovir treats herpes viruses, not anthrax. Option B is incorrect because zitavudine is used for HIV. Option D is also wrong, as oseltamivir is for influenza. Remember, inhalation anthrax has a high mortality rate, so early aggressive antibiotic therapy is life-saving, followed by prolonged prophylaxis to address persistent spores. Question 48. Finally, let us review safe delegation in the care of a critically ill client. The nurse is caring for a client with a spinal cord injury who is experiencing shock. Which task can appropriately be delegated to unlicensed assistive personnel? The options are A. Transport the client to the radiology department. B. Perform passive range of motion exercises. C. Gather cardiac monitoring equipment. D. Obtain vital signs. The correct answer is C. Gather cardiac monitoring equipment. This task supports the nurse's preparation for critical assessment without requiring clinical judgment. Option A is inappropriate because transporting a client in shock requires nursing supervision. Option B should not be delegated, as improper range of motion could harm spinal stability. Option D is inappropriate because in shock, vital signs require immediate interpretation by the nurse to guide urgent care. In critical care, delegation must match both the client's condition and the assistant's scope of practice, with the nurse retaining responsibility for safe execution. Question 49. Let us now focus on recognizing a surgical emergency. A client who sustained a right leg fracture during an industrial accident reports severe pain and tingling under a newly applied plaster cast. The nurse notes that the exposed toes are cyanotic. What is the most appropriate nursing action? The options are A. Apply heat packs to the leg. B. Elevate the affected extremity. C. Contact the healthcare provider immediately. D. Instruct the client to wiggle their toes. The correct answer is C. contact the healthcare provider immediately. These symptoms strongly suggest compartment syndrome, a condition that can lead to permanent tissue damage or limb loss if untreated. The cast must be removed or split without delay to relieve the pressure. Option A is incorrect because heat can worsen swelling. Option B is not appropriate, as elevation could further impair blood flow. Option D wastes valuable time when immediate action is needed. Always prioritize early recognition and urgent communication in cases of suspected compartment syndrome. Question 50. Next, let us consider a scenario involving health equity. The nurse is participating on a committee aimed at promoting healthcare justice in the community. Which recommendation best aligns with this goal? The options are A. Establish interdisciplinary collaboration between nursing and nutritional services. B. Provide more confidential waste containers at local drugstores. C. Offer free telehealth services in underserved areas. D. Allow inpatient clients to select their meal times. The correct answer is C. Offer free telehealth services in underserved areas. This promotes equitable access to healthcare and reduces disparities by providing care to populations that face barriers. Option A enhances care coordination, but does not address community-level justice. Option B supports privacy, but not justice in access. Option D promotes autonomy, but does not address healthcare justice. Remember, justice in healthcare focuses on fairness and eliminating barriers to care. Question 51. Let us now review important client teaching for a common urinary analgesic. The nurse is providing discharge instructions to a client prescribed phenazopyridine. What teaching point should the nurse include? The options are A. The amount of urine you produce will increase. B. Your urine may turn orange in color. C. You may notice your urine has a strong odor. D. Concentrated urine is expected while taking this medication. The correct answer is B. Your urine may turn orange in color. This discoloration is harmless but can be alarming if the client is unprepared. Option A is incorrect, as phenazopyridine does not affect urine output. Option C is not correct because it does not cause malodorous urine. Option D is incorrect because the medication does not concentrate urine. Always advise clients that phenazopyridine offers symptom relief, not a cure for infection, and they should follow up if symptoms persist. Question 52. Moving on, let us consider client safety during an acute episode of vertigo. The nurse is caring for a client experiencing an acute episode of vertigo. Which action should the nurse prioritize? The options are A. Instruct the client to avoid sudden, jerky movements. B. Request a prescription for an antihistamine. C. Raise the upper side rails of the client's bed. D. Assess the client for nausea and vomiting. The correct answer is C. Raise the upper side rails of the client's bed. The immediate priority is preventing falls. While the other actions are helpful, protecting the client from injury comes first. Option A is supportive, but not the immediate priority. Option B may help manage symptoms, but does not address safety right away. Option D is part of ongoing care, but fall prevention takes precedence. Always implement fall precautions when vertigo is present. Question 53. Next, let us look at a common cause of bronchiolitis in toddlers. The nurse is reinforcing education to the parents of a toddler diagnosed with bronchiolitis. What should the nurse identify as the most common cause of this condition? The options are A. Haemophilus influenza type B adenovirus. C. Respiratory syncytial virus, RSV. D. Rhinovirus. The correct answer is C. Respiratory syncytial virus, RSV. RSV is the leading cause of bronchiolitis in children under 2 years, causing small airway inflammation and mucus buildup. Option A is linked to epiglottitis, not bronchiolitis. Option B can cause respiratory infections, but is less common as a cause of bronchiolitis. Option D is a major cause of the common cold, not bronchiolitis. Emphasize supportive care and monitoring for respiratory distress with RSV infections. Question 54. Finally, let us review fetal monitoring and prioritization during pregnancy. The nurse has received the following information about assigned clients. The nurse should initially assess the client who is at A. 15 weeks gestation, who reports not feeling any fetal movement. B. 28 weeks gestation, who reports swollen feet and ankles. C. 36 weeks gestation, who reports contractions that are irregular. D. 37 weeks gestation, experiencing variable decelerations. The correct answer is D. 37 weeks gestation, experiencing variable decelerations. Variable decelerations suggest umbilical cord compression, which can compromise fetal oxygenation. Immediate assessment and intervention are necessary to protect fetal well-being. Option A is not urgent because fetal movement is not consistently felt until 16 to 20 weeks. Option B is common in the third trimester and not an emergency without other signs. Option C likely reflects Braxton Hicks contractions, which are not harmful. Always prioritize signs of fetal distress in pregnancy assessments. Question 55. Let us now review essential teaching points from prenatal education. The nurse is educating clients attending a prenatal class. Which of the following statements should the nurse include? The options are A. Chorionic villus sampling, CVS, may detect neural tube defects. B. Maternal serum alpha-fetal protein, MSAFP, may determine gender. C. Amniocentesis may be used to assess for chromosomal abnormalities. D. A biophysical profile, BPP, assesses 6 variables such as fetal glucose. The correct answer is C. Amniocentesis may be used to assess for chromosomal abnormalities. Amniocentesis is used to detect neural tube defects, chromosomal abnormalities, fetal sex, and later in pregnancy, lung maturity. Option A is incorrect because CVS identifies chromosomal abnormalities, but not neural tube defects. Option B is wrong as MSAFP screens for neural tube defects, not fetal gender. Option D is inaccurate because a BPP assesses 5 variables: fetal breathing movements, body movements, tone, amniotic fluid index, and heart rate patterns, not fetal glucose. Remember, informed consent is required before amniocentesis, and Rh-negative clients should receive RhoGAM afterward. Imagine this: live NCLEX classes where you can ask questions, 100 hours of animated crash course lessons that make tough topics easy, and 500 hours of recorded lectures you can watch anytime, anywhere. Add to that 500 next-generation NCLEX questions explained in detail, 5,000 real NCLEX questions, 15 CAT-style mock tests, an exclusive ebook, custom study planners, and PDF notes, all with one full year of access. We built this course to guide you every step of the way. Let us help you cross that finish line. Enroll today. Link is in description. Next, let us turn to a sensitive but critical topic involving children's understanding of death. You are caring for a 33-year-old client at the end of life who has a 14-year-old son and an 8-year-old daughter. Which key consideration should guide the nurse's approach when explaining death to these children? The options are: A. Children under 12 typically view death as terrifying, so discussions about death should be avoided. B. Children under 12 generally have no concept of death, its meaning, or its finality. C. A child's level of cognitive development plays a major role in how they perceive and understand death. D. A child's cognitive development does not influence how they understand death before age 12. The correct answer is C. A child's level of cognitive development plays a major role in how they perceive and understand death. Younger children may see death as temporary or reversible, while adolescents usually understand its finality, but may struggle emotionally. Option A is incorrect because avoiding the topic can lead to confusion and fear. Option B is inaccurate as even young children form ideas about death, though these may be incomplete. Option D is wrong because cognitive development absolutely shapes how children grasp the concept of death. Always provide age-appropriate, honest explanations and emotional support. Question 57. Now, let us examine a dynamic that can affect family relationships during conflict. The nurse is interviewing a family and observes tension between the two parents. The child reports that the mother often involves her in deciding who is right during disagreements. This scenario is an example of which family dynamic? The options are A. Triangulation, B. Coalition, C. Fusion, D. Differentiation. The correct answer is A. Triangulation. This occurs when a child is pulled into parental conflicts, being asked to mediate or choose sides, which can cause emotional stress and confusion. Option B refers to 2 family members forming an alliance against a third, which is not what is described here. Option C is incorrect, as fusion describes overly enmeshed relationships with blurred boundaries. Option D is incorrect because differentiation represents healthy independence within relationships, which is not evident in this case. Nurses can help families identify and reduce unhealthy patterns like triangulation to support better communication. Question 58. Finally, let us focus on a priority intervention during diabetic ketoacidosis management. The nurse is caring for a client with diabetic ketoacidosis, DKA, receiving an intravenous regular insulin infusion. The client's most recent potassium level is 2.9 milliequivalents per liter. What is the nurse's priority action? The options are A. Notify the primary healthcare provider. B. Stop the regular insulin infusion. C. Obtain a 12-lead electrocardiogram. D. Assess the client's urine output. The correct answer is B. Stop the regular insulin infusion. Continuing insulin with this critically low potassium level would worsen hypokalemia, increasing the risk of life-threatening arrhythmias. The immediate priority is to stop the insulin to prevent further potassium shift into the cells, then notify the provider and anticipate potassium replacement. Option A is necessary, but secondary to taking action to prevent harm. Option C might help detect arrhythmias, but does not prevent them. Option D is important in DKA care, but is not the top priority in the situation. Always monitor potassium closely during DKA treatment and address hypokalemia before resuming insulin. Question 59. Let us now focus on raising awareness about a significant genetic condition. The nurse is working with an advocacy group to raise awareness about cystic fibrosis. Which statement best describes this condition? The options are A. It is an inherited disease that causes inflammation and hypersensitivity of the airway. B. It is an infectious disease that causes inflammation and fluid buildup in the alveoli of the lungs. C. It is an inherited disease that causes thick, sticky mucus to accumulate and block organs. D. It is an acquired disease that causes swelling of the epiglottis and airway obstruction. The correct answer is C. It is an inherited disease that causes thick, sticky mucus to accumulate and block organs. Cystic fibrosis is an autosomal recessive genetic disorder that affects ion transport, resulting in mucus buildup that clogs the lungs, pancreas, and other organs, leading to chronic infections and malnutrition. Option A describes asthma. Option B refers to pneumonia. Option D describes epiglottitis. Management includes airway clearance, pancreatic enzyme replacement, and high-calorie diets. Question 60. Let us now review important teaching for clients with hiatal hernia. The nurse provides discharge teaching to a client with a hiatal hernia. Which client statement indicates correct understanding? The options are A. I should wear loose-fitting clothes to reduce pressure on my abdomen. B. After I eat, I should lie down to help digestion. C. Eating 3 large meals a day will help my symptoms. D. Spicy foods will not affect my hiatal hernia symptoms. The correct answer is A. I should wear loose-fitting clothes to reduce pressure on my abdomen. Loose clothing reduces intra-abdominal pressure, helping minimize reflux. Option B is incorrect. Clients should stay upright after meals. Option C is wrong because small, frequent meals are recommended. Option D is incorrect because spicy foods can worsen reflux. Key teaching includes eating small meals, avoiding late-night eating, and elevating the head of the bed. Question 61. Next, let us address infection control practices. The nurse has attended a staff in service about infection control. Which observation demonstrates correct application of the teaching? The options are A. Wearing a face shield while flushing a client's nasogastric tube. B. Cohorting a client with HIV with a client who has hepatitis. B. C. Wearing a protective gown while caring for a client with measles. D. Instructing a visitor to wear an N95 respirator before entering the room of a client with tuberculosis. The correct answer is B. Cohorting a client with HIV with a client who has hepatitis. B. Both infections are bloodborne, and standard precautions are sufficient. Option A is unnecessary unless splashing is expected. Option C is incorrect. Measles requires an N95 respirator, not a gown. Option D is incorrect because visitors typically wear surgical masks. N95s are for fit, tested staff. Question 62. Let us practice a dosage calculation for safe pediatric care. The nurse is preparing to administer vancomycin to a child. The prescription reads 50 milligrams per kilogram per day, divided into 3 doses. The child weighs 13 kilograms. The available vancomycin is supplied as 500 milligrams in 100 milliliters of saline. Now, the question is, how many milliliters will the nurse administer per dose? Let us break it down together. First, calculate the total daily dose. Multiply 50 milligrams by the child's weight of 13 kilograms. That gives us 650 milligrams per day. Next, since the dose is divided into 3 parts, we divide 650 by 3, which equals approximately 200 to 16.7 milligrams per dose. Now, let us figure out the volume to give. Take 216.7 milligrams, divide by 500 milligrams, and multiply by 100 milliliters. That gives us about 43.3 milliliters, which we round to 43 milliliters per dose. The final answer is 43 milliliters per dose. Remember, it is crucial to administer vancomycin slowly to reduce the risk of red man syndrome and always monitor the child for any signs of infusion reaction. Question 63. Next, let us review safe medication practices. The nurse is leading a staff development session about medication reconciliation. Which statement reflects correct teaching? The options are: A. Medication reconciliation should only occur at discharge. B. Only prescribed medications should be reviewed. C. Medication reconciliation should occur at admission, client transfer, and discharge. D. It is sufficient to obtain a list of medications without reviewing it with the client. The correct answer is C. Medication reconciliation should occur at admission, client transfer, and discharge. This process helps prevent errors during care transitions. Option A is incorrect, because reconciliation at discharge alone is insufficient. Option B is wrong, as all substances, including supplements, must be reviewed. Option D is incorrect. Client engagement ensures accuracy. Question 64. Finally, let us review a prenatal prioritization scenario. The nurse is triaging phone calls at a prenatal clinic. Which client report requires immediate follow-up? The options are: A. 10 fetal movements in the past hour. B. Irregular, painful contractions that lessen with position changes. C. Abdominal cramping 6 hours after amniocentesis. D. Epigastric pain and a frontal headache unrelieved by acetaminophen. The correct answer is D. Epigastric pain and a frontal headache unrelieved by acetaminophen. These are signs of severe preeclampsia, requiring urgent evaluation to prevent complications such as seizure or placental abruption. Option A is reassuring. Option B suggests Braxton Hicks contractions. Option C describes a normal post-amniocentesis symptom unless accompanied by worsening pain, fluid leakage, or bleeding. Question 65. Let us now consider the safe administration of a medication with a narrow therapeutic window. You are caring for an 80-year-old woman with a long-standing history of asthma, who is scheduled to receive a dose of theophylline. Which assessment is most critical for the nurse to perform before administering this medication? The options are: A. Temperature, B. Blood pressure, C. Urinary output, D. Pulse. The correct answer is D. Pulse. Theophylline toxicity can lead to dangerous cardiac arrhythmias, often presenting early as tachycardia or an irregular pulse. Given the drug's narrow therapeutic range, even doses that were previously tolerated can result in toxicity, especially in older adults who may have slower drug clearance. If the nurse detects a significantly elevated or irregular pulse, the dose should be held and the healthcare provider notified for further evaluation, which may include measuring a serum theophylline level. Option A is incorrect because temperature is not a key indicator of theophylline toxicity. Option B is incorrect as blood pressure changes may occur later, but pulse abnormalities are an earlier sign. Option C is incorrect because urinary output is not directly influenced by theophylline levels. Ready to pass the NCLEX like a pro? Our complete NCLEX review course gives you everything you need. Live NCLEX classes, 100 hours of animated crash course lessons, 500 hours of recorded lectures, 500 next-generation NCLEX questions with deep explanations, and over 5,000 previously asked NCLEX questions. Plus, you will get 15 CAT-style mock tests, an exclusive NCLEX ebook, study planners that fit your timeline, PDF notes, and 1 full year of access after you enroll. Link in the description. This is not just a course, it is your shortcut to success. Question 66. Let us now shift our focus to burn injuries and the immediate priorities of care. A nurse is caring for a client who sustained burns to the face, neck, and chest in a house fire. Which assessment finding requires immediate intervention? The options are: A. Hoarse voice and difficulty speaking. B. Heart rate of 110 beats per minute. C. Pain rated at 8 out of 10. D. Burn blisters noted on both arms. The correct answer is A. Hoarse voice and difficulty speaking. These signs are classic indicators of an inhalation injury, suggesting airway edema that can progress rapidly to complete airway obstruction. The nurse must act without delay by notifying the healthcare provider and preparing for early intubation to secure the airway before swelling makes intubation impossible. Option B is incorrect, as a mildly elevated heart rate is expected in burn patients due to stress or fluid shifts. Option C is incorrect, because pain is an expected finding and, although important, does not take priority over airway protection. Option D is incorrect because while burn blisters on the arms require attention, they do not pose the same immediate life-threatening risk as airway compromise. Always remember, in facial or neck burns, airway assessment and early intervention are paramount to saving the client's life. Question 67. Let us now explore a case involving fluid and electrolyte imbalance and the nurse's immediate priority. A nurse is caring for a client with severe diarrhea. The client's laboratory results show a sodium level of 128 milliequivalents per liter and a potassium level of 3.0 milliequivalents per liter. Which is the priority nursing action? The options are A. Place the client on seizure precautions. B. Offer oral potassium supplements immediately. C. Encourage the client to drink clear fluids. D. Prepare the client for dialysis. The correct answer is A. Place the client on seizure precautions. The client's sodium level indicates significant hyponatremia, and severe hyponatremia can lead to cerebral edema, increasing the risk of seizures and altered mental status. The nurse's immediate priority is to protect the client's safety by initiating seizure precautions while medical treatment is arranged. Option B is incorrect, because although potassium replacement is needed, the neurological risks from hyponatremia take precedence. Option C is incorrect because offering clear fluids may worsen hyponatremia, especially if the fluids are hypotonic. Option D is incorrect because dialysis is not indicated at this stage unless there is accompanying renal failure or life-threatening electrolyte imbalance. Always remember, in electrolyte emergencies, the nurse must identify and act on the imbalance that poses the most immediate threat to life. And in this case, it is the hyponatremia. Question 68. Let us now review a question focused on discharge teaching after eye surgery. A nurse is providing discharge instructions to a client following cataract removal with intraocular lens implantation. Which statement by the client indicates the need for further teaching? The options are A. I will avoid bending at the waist to tie my shoes. B. I should wear an eye shield while sleeping. C. I can lift objects that weigh up to 20 pounds. D. I will contact the clinic if I have worsening vision or pain. The correct answer is C. I can lift objects that weigh up to 20 pounds. After cataract surgery, clients are advised to avoid heavy lifting, generally anything over 5 to 10 pounds, because lifting heavier objects can increase intraocular pressure and lead to complications such as hemorrhage or displacement of the intraocular lens. Option A is correct teaching because avoiding bending at the waist helps minimize pressure inside the eye. Option B is also correct, as wearing an eye shield while sleeping protects the eye from accidental rubbing or injury during the night. Option D is correct because the client should report any signs of complications like worsening vision or pain, as these could signal infection or retinal detachment. Always remember, protecting the eye from strain and trauma is key in the early recovery period after cataract surgery. Question 69. Let us now focus on an obstetric emergency where rapid nursing action is crucial. A nurse is caring for a client who is 1 hour postpartum following a vaginal delivery. The nurse notes that the client's perineal pad is saturated within 15 minutes and blood is pooling beneath the client. What is the priority nursing action? The options are A. Massage the client's fundus firmly. B. Increase the intravenous fluid rate. C. Obtain a prescription for an oxytocin bolus. D. Check the client's blood pressure and pulse. The correct answer is A. Massage the client's fundus firmly. A saturated pad in such a short time signals significant postpartum hemorrhage, most often due to uterine atony, when the uterus fails to contract effectively after delivery. The nurse's immediate priority is to massage the fundus firmly to stimulate uterine contraction and reduce bleeding. Option B is incorrect because increasing intravenous fluids supports circulation, but does not address the cause of bleeding. Option C is incorrect because although oxytocin administration is important, fundal massage is the first direct intervention the nurse can initiate without delay. Option D is incorrect because while vital signs are important to monitor, The priority is to act quickly to stop the bleeding rather than continue assessing. Remember, postpartum hemorrhage requires immediate intervention to prevent shock and serious complications, and fundal massage is always the first-line nursing action. Question 70. Let us now look at postpartum nursing care focused on promoting comfort and healing. A nurse is providing care for a client who is 6 hours postpartum following a vaginal delivery with a midline episiotomy. Which nursing intervention is most appropriate to promote comfort and healing at this time? The options are A. Apply an ice pack to the perineal area. B. Encourage the client to take a warm sitz bath. C. Massage the perineum gently every 2 hours. D. Teach the client to perform pelvic muscle exercises. The correct answer is A. Apply an ice pack to the perineal area. In the first 24 hours after an episiotomy, cold therapy with an ice pack helps reduce swelling, numb the area, and provide pain relief, making it the most appropriate intervention during the immediate postpartum period. Option B is incorrect because warm sitz baths are beneficial for promoting circulation and healing, but they are generally recommended after the first 24 hours. Option C is incorrect as massaging the perineum could cause pain or disrupt the healing process. Option D is incorrect because while pelvic muscle exercises, such as Kegels, support long-term recovery, they are not a priority for immediate comfort or healing in the first few postpartum hours. Always remember, cold therapy is the first step in managing perineal discomfort and swelling after an episiotomy. Question 71. Let us now focus on a teaching scenario involving a couple undergoing infertility evaluation. A couple is undergoing evaluation for infertility. The nurse provides teaching about factors that may affect female fertility. Which statement by the client indicates a need for further teaching? The options are A. I should monitor my menstrual cycles to identify ovulation patterns. B. My body weight could affect my ability to conceive. C. Douching regularly after intercourse will help improve my chances of becoming pregnant. D. Stress can sometimes interfere with fertility. The correct answer is C. Douching regularly after intercourse will help improve my chances of becoming pregnant. Douching is not recommended for women trying to conceive because it can alter vaginal flora, disrupt sperm motility, and reduce the likelihood of fertilization. This statement indicates a misunderstanding and requires further teaching. Option A is correct because monitoring ovulation patterns can help identify the most fertile window for conception. Option B is correct because being either underweight or overweight can disrupt ovulation and menstrual regularity, negatively impacting fertility. Option D is correct because stress can interfere with hormonal balance, making stress management an important aspect of fertility care. Always remember, client education about fertility should include avoiding practices that may hinder conception, maintaining a healthy weight, and supporting stress reduction strategies. Question 72. Let us now review a mental health scenario focused on identifying delusions. A nurse is assessing a client who states, "I am the queen of the universe, and I have been chosen to save the world from destruction." Based on this statement, what type of delusion is the client experiencing? The options are A. Persecutory delusion, B. Somatic delusion, C. Grandiose delusion, D. Referential delusion. The correct answer is C. Grandiose delusion. A grandiose delusion is characterized by an exaggerated sense of one's own importance, power, or identity. In this case, the client's belief that they are the queen of the universe with a mission to save the world clearly reflects grandiosity. Option A is incorrect because persecutory delusions involve beliefs that one is being plotted against or harmed. Option B is incorrect because somatic delusions involve false beliefs about the body, such as having a serious illness without evidence. Option D is incorrect because referential delusions involve thinking that unrelated events or messages, like those on TV, have special meaning for the individual. Always remember, accurately identifying the type of delusion is key to providing therapeutic communication and appropriate care while ensuring the client's safety and emotional well-being. Let us wrap this session with a psychiatric assessment scenario focused on speech patterns. A nurse is assessing a client with schizophrenia. The client repeats everything the nurse says. For example, when the nurse asks, "How are you feeling today?" the client responds, "How are you feeling today?" How should the nurse document this speech pattern? The options are A. Neologism, B. Clang association, C. Echolalia, D. Word salad. The correct answer is C. Echolalia. Echolalia refers to the automatic and meaningless repetition of another person's spoken words. In this case, the client repeats the nurse's question verbatim without providing a meaningful response, which is classic echolalia. Option A is incorrect because neologism refers to made-up words that have meaning only to the client. Option B is incorrect because clang association involves speech where words are chosen based on their sound, such as rhyming, rather than meaning. Option D is incorrect because word salad describes speech that consists of a jumble of unrelated words and phrases that lack logical connection. Always remember, recognizing echolalia is important for identifying thought disturbances and planning communication strategies. Use simple, clear language and assess for other signs of disordered thinking when this speech pattern is observed. We will back with new videos soon.